Hi, my name's Courtney Beaupre.
And my name's Michelle Bertelli, and this is Mental Health Matters.
This episode is on eating disorders and disordered eating.
Eating disorders are a broad collection of serious conditions in which a person is so preoccupied with food and/or weight that they can focus on little else, and this causes significant distress in their lives. They also can be life-threatening. The main types of eating disorders are anorexia nervosa, bulimia nervosa, and binge eating disorder. Anorexia nervosa is defined as a failure to maintain a healthy body weight and an intense fear of becoming overweight. This can include the restriction of food intake or binging and purging cycles. Binging is when a person eats excessively, and purging is when a person finds a way to get rid of the food they ingested. These means can be through vomiting, taking laxatives, fasting, excessive exercise, and more. Bulimia nervosa is the consistent cycle of binging and then purging. And binge eating disorder is where the person only binges. For example, eating until uncomfortably full, eating faster than normal, or eating secretly. Although these are the main types of eating disorders, there are many subtypes and various kinds of disordered eating behaviors.
Eating disorders and disordered eating are exceptionally common. In fact, in the United States, eating disorders are more common than Alzheimer's disease. As many as 10 million people have eating disorders compared to 4 million with Alzheimer's disease. An estimated 1 in 100 American women binges and purges to lose weight. Even more shocking, 95% of those who have eating disorders are between the ages of 12 and 25. As Michelle mentioned earlier, eating disorders can be life-threatening. Specifically, anorexia nervosa has the highest premature fatality rate of any mental illness, yet only 1 in 10 people with eating disorders receive treatment. This is in part due to the financial cost of treatment, with the average cost of 1 month's stay in an inpatient treatment center costing approximately $30,000. The average need for inpatient treatment is between 3 and 6 months. That leaves treatment costs generally around $100,000 or more.
Eating disorders tend to affect more females than males, but are not solely a woman's problem or something for girls. Males are also affected by eating disorders, which commonly include binge eating and/or steroid use. Over 1/2 of teenage girls and nearly 1/3 of teenage boys use unhealthy weight control behaviors such as skipping meals, fasting, smoking cigarettes, vomiting, and taking laxatives. Girls who diet frequently are 12 times as likely to binge as girls who don't diet. As for age, we are finding that eating disorders can begin as young as age 8, and it is reported that 81% of 10-year-olds are afraid of being fat.
So what causes an eating disorder? Eating disorders are highly complex, and the cause may be variable depending on the individual. However, some factors may be biological or genetic, psychological, environmental, or social. What this means is that some people may be more influenced by their social network and media messages, while another person may have a genetic disposition or even a biological condition, or even a combination of both. Although we may not know an exact cause, we do know some risk factors. These risk factors include gender. Teenage girls and young women are more likely than teenage boys and young men to have an eating disorder. Age. Although eating disorders can occur across a broad age range, from pre-adolescents to older adults, they are much more common during the teens and early 20s. Family influences. People who feel less secure in their families, whose parents and siblings may be overly critical, or whose families tease them about their appearance, are at a higher risk of eating disorders. Emotional disorders. People with depression, anxiety disorders, and obsessive-compulsive disorder are more likely to have an eating disorder.
Dieting. People who lose weight are often reinforced by positive comments from others and by their changing appearance. This dieting may be taken too far and lead to an eating disorder. Transitions. Whether it's heading off to college, moving, landing a new job, or a relationship breakup, change can bring emotional distress. One way to cope, especially in situations that may be out of someone's control, is to latch onto something that they can control, such as their eating patterns, which can eventually lead to an eating disorder if taken to an extreme. Sports, work, and artistic activities. Athletes, actors, and television personalities, dancers, and models are at a higher risk for eating disorders. Eating disorders are particularly common among ballerinas, gymnasts, runners, and wrestlers. Coaches and parents may unwillingly contribute to eating disorders by encouraging young athletes to lose weight. Media and society. The media, such as television and fashion magazines, frequently focus on body shape and size. Exposure to these images may lead some people to believe that thinness equates to success and popularity.
Eating disorders aren't generally easy to see. Most people are accustomed to the idea of a 70-pound female whose bones are protruding from her skin, but the majority of people with eating disorders can't be picked out of a crowd. They are both men and women of all sizes and shapes and backgrounds. It could be the kid on the wrestling team or a mother of 3. Some signs that a person may have an eating disorder include exercising longer or more often than most people, skipping meals, thinking about food all the time, obsessing over calorie counts, having scars on their knuckles from trying to induce vomiting, the use of laxatives, enemas, or steroids, negative or distorted body image, and in females, they may stop menstruating, irritability, depression, and intense mood swings, erosion of tooth enamel from vomiting, thinning of hair or hair loss. These are just a few signs that a person may show with an eating disorder, and the longer it is sustained, the worse the signs may be, such as heart arrhythmias, infertility, osteoporosis, tooth loss, and more.
Treatment and prevention. Unfortunately, there isn't a one-size-fits-all approach to treatment. Treatment varies depending on the individual's situations and needs. For instance, a person suffering from anorexia may need medical treatment before receiving psychological treatment.
The most effective treatment for eating disorders is some form of psychotherapy or counseling, along with ongoing assessment and treatment for medical and nutritional needs. It may require a network of providers such as a primary care physician, a mental health professional, a nutritionist, a dentist, and a gynecologist. It is important to find a licensed therapist who has experience or training in eating disorders. Also, some medications, such as antidepressants, have shown to be helpful for some individuals. However, once again, each treatment plan should be tailored to fit the individual. Treatment should not only address the eating disorder symptoms, but the physiological, psychological, biological, interpersonal, and cultural factors that contribute to or maintain the eating disorder. Many people with eating disorders respond well to outpatient therapy, which include individual, group, and/or family therapy, like the network mentioned earlier, along with medical management by their primary care provider. Inpatient care, including hospitalization and/or residential care in an eating disorders specialty unit or facility, is necessary when an eating disorder has led to life-threatening physical problems or when an eating disorder has reached a level of severe psychological or behavioral problems. Inpatient stays typically require a period of outpatient follow-up and aftercare to address the underlying issues in the individual's eating disorder.